binge drinking be curbed with a pill? Welcome back, I'm Marcella Lee.
I'm Jesse Pagan in for Carlo Cicchetto. A medicine that's been around for decades could help you cut down how much you drink if you take it before your first sip.
CBS 8's Kirsten Holmes takes a closer look as more Americans are finding out they may have started drinking too much during the pandemic.
If you ever woke up regretting the last round of drinks from the night before, you are not alone. Hangovers can be treacherous, and it only gets worse as you get older. But if there was a medicine that would help you stop drinking so much, would you take it? Doctors we talk to say the real question is, should you?
A lot of people think that alcohol is not a drug, and it is.
Joey Rubio is a drug and alcohol counselor at the McAllister Institute, a substance abuse treatment program in Chula Vista. He says alcohol abuse is typically tied to mental health issues.
Today, the courts mandate you to go to a program. They mandate you to go to, NA, AA. If they would have mandated me to go get an evaluation from a therapist, I would have probably addressed my problem a long time ago.
Joey says he was never offered or prescribed any medicine to curb his drinking. He's sober now, but he says medicines would have helped him had he had access to them when he needed it.
And it was a real ugly, I've been to some ugly places behind drugs,
Dr. Barbara Mason is the director of the Alcohol Research Center at the Scripps Research Institute. She says there are 3 FDA-approved medications that can treat alcohol use disorder: disulfiram, acamprosate, and naltrexone.
It doesn't change the brain. It's only effective while it's in the system. And that's why it's important to pair with a behavioral therapy.
So none of the currently FDA-approved medicines to treat alcohol use disorder offer an ultimate cure. And patients who take these medicines often report nausea, which doctors say can cause some of their patients to stop taking the medication altogether. But a new study in December of last year reported that patients who took naltrexone before they expected to drink eventually saw the nausea resolve itself once they adjusted to the drug. And users that stuck with it reported less drinking. Now doctors say they may have found a new potential treatment for alcohol abuse that removes that side effect barrier in a drug that already exists on the market. Dr. Mason says she studied Otezla, a drug normally used to treat psoriasis for alcohol use disorder.
For psoriasis, it takes up to 4 months before you start seeing treatment effects. For alcohol, it acts right away. It acts to inhibit a specific type of molecule in the brain.
The results cut a patient's alcohol intake by more than half, and Dr. Mason said another unwanted side effect was adjusted.
Element of the molecule that directs the nausea was removed. We didn't have a single person leaving the study because of any gastrointestinal side effects.
Right now, Otezla, also known as apremilast, is only FDA approved for the treatment of psoriasis. Getting FDA approval for Otezla to treat alcohol use disorder will take a few more years, Dr. Mason says.
These findings are just a couple of months old. They really need to be replicated by large treatment-seeking samples all over the country.
Dr. Jim Dunford with the McAllister Institute says the current drugs on the market are underprescribed by doctors. He's excited that the medicines are now getting a second look. But Dr. Dunford warns no pill is a cure-all for alcohol use disorder, and he stresses medications must be coupled with group or individual behavioral therapy.
There are medicines to get you to kind of reduce the craving. There are groups that provide the support and the kind of the social and ecosystem that you need to kind of learn how to work within.
Dr. Dunford is encouraged by where medicine is heading in the fight against alcohol use disorder.
There are enough out there that we're trying to encourage physicians, primary care physicians in particular, to try these medicines on their people, but knowing that they're not going to be the only solution.
Joey says he knows firsthand how drugs and alcohol can ruin a person's life, and he's encouraged that doctors are continuing to look for new ways to offer hope.
It sounds like it's very promising, it would help a lot of people.
Kirsten Holmes, CBS 8.
Thanks, Kirsten. For help with substance abuse, you can call the Substance Abuse and Mental Health Services Administration's national helpline. That number is 1-800-662-HELP. You can also reach out directly to the McAllister Institute by going to our website, cbs8.com, and clicking on this story.